It is clear there is a growing mental health problem in the country in which the youth are the hardest hit and who deal with pandemic despair and depression the best they can by taking their lives. And the number of suicides thus far are eye-opening and still on the rise, which today's Senate hearing on a proposed Mental Health Act took up and laid out by our Daniel Manalastas in this report.
Nasa pandemic of mental health na tayo ngayon eh.
This is how Senator Gatchalian described the continued climb in suicide cases in the country. During the hearing of Senate Committee on Health on the implementation of Mental Health Act, Gatchalian cited the data from the Philippine Statistics Authority wherein in 2019, they tallied more than 2,800 suicide cases, which even doubled to more than 4,400 cases in 2020.
Tumatawag sa inyo 2,800, pero nagpakamatay 4,400. There are more unreported suicide cases. So what are we doing? It's the pandemic of mental health is already here. And that's scary because people are now hopeless. They don't find any use to call the hotline.
We are developing other platforms to reach people. The first of which is the self-paced mechanism, the Lusog Isip app, yung importance nga po talaga ng school-based intervention. So aside from the pilot on the suicide prevention in schools that we've pre-tested this year, we're already discussing also with DepEd how to augment their capacity.
Anxiety, work problems, love life, family, and just having someone to talk to are the common cases received by their hotline, according to the Health Department.
That's why we have peer support groups because of the need for counseling on their points of care. That's why we also have workplace and school-based programs. But definitely, sir, there are a lot of room for improvement.
Senator Raffy Tulfo, meanwhile, blasted the National Center for Mental Health because of different problems they face in their facility, as Tulfo alleges.
Kaawa-awa sila, Mr. Chair. Nakahiga sa sahig. Walang ventilation. Mamaya na yung ventilation. Nakahiga sa sahig. Nasaan na po yung budget para sa isang pasyente, bawat pasyente na meron silang dapat kumot, unan at banig. What happened to that?
It's highly congested pavilion. And if I put beds there, sir, hindi magkakasya yung total number of patients.
Bakit hindi ka gumawa ng paraan na para i-decongest?
Actually, sir, the plan to decongest has always been there. I was there with you during your rounds.
Correct.
And I was
Thank you.
answering your questions during that time. And I stated that at night time, these patients are being given banig.
The senators also inquired into the NCMH alleged food security problem.
Mr. Chair, nung pumunta ako doon, isa sa mga pasyenteng nakausap ko, sabi, bitin po sir ang pagkain namin dito. Ibig sabihin, God damn, pati sa pagkain, wala nang awa, dudugasan niyo pa yung mga kawawang pobreng pasyente ng NCMH.
Yung binibigyan niya ng mga pagkain, no? Since meron silang mental health problem, meron bang nakakareklamo ba sila?
Yes, sir. They are stating their condition to the nurses. Gutom pa ako. So the nurses will take effort now to have a second serving.
Sa klase ng pagkain, nakakareklamo ba sila?
Opo.
Ano
sabihin nila, walang lasa, o sasabihin nila. So we try to improve on it for them.
Napaka-importante po nito, Dr. Reyes, para gumaling yung pasyente, dapat
I agree po.
ma-comply nyo yung requirements talaga nila.
For now, Senator Bongo says they just have to suspend the hearing and may continue if complaints keep on coming. Daniel Manalastas for The Nation.